extraction or injury to an unerupted tooth. As you remember, in the previous lecture, we said on the deciduous teeth, we take X-ray before extraction, okay? And we see the roots. If they were intact, I will separate the tooth. If they were resorbed, I will go extraction in the normal manner, okay? But if I didn't take X-ray and I didn't know the roots were intact, I might extract the permanent with the deciduous, okay? Or at least cause injury for it. Clear until now? Okay? Question? Any questions? Okay. Gingival laceration. As I put the elevator now in front of you all, you saw it. The elevator might slip from my hand, okay, and cause gingival laceration. Okay? Gingival. And I will cut the gingiva, yes. I'm sorry. It's a complication. Is it normal? Okay. No, this is not surgery. You are extracting a tooth. This has happened by accident. Okay? You didn't open a flap. Okay? Yeah. I was moving the tooth. Okay? I was moving the tooth, Dr. Hatem. Okay. I was moving the tooth, and then the instrument slipped from my hand, and either I cause laceration to the gingiva or injury to the tongue. The next point. Just let me finish, and then I will answer anything you want. Well, okay? So I might get gingival laceration or wound to the tongue because of slippage of the instrument. Okay? So I have to hold it very hard, at the same time correct direction of the force. Okay? Clear? Okay. Next point, bruising of the lip or the cheek. Do you know what's bruising?
No.
شايفين واحد من يضرب بوكس بعينه؟
ورم
زرقاء.
ورم
لا الزرق هذا. يعني if it gets bluish, okay? This bluish discoloration is the bruising. This is bruising, okay? I think in general medicine you will study a disease called no, it's listen. No, ecchymosis. Something called ecchymosis. That the patient, if you touch him like this, he will get bruised in this area because he has a low rate of platelets or he doesn't have platelets at all. Okay? So this is called ecchymosis. Ecchymosis is bruising in all the body. Simply by closed, he might bruise himself. Okay? Shinebe. Internal bleeding. That's why it appears bluish. Okay? Clear?
During extraction, for example,
Yeah. Yes. No, I will not hit the lip. Do you know what could happen? Especially in the lower. Or the upper. But in the lower more. While I'm holding the tooth with the forceps, okay? This part of the forceps might hit the lip or press on the lip. And the patient is not feeling, he cannot tell you that he is in pain. Okay? Also after the extraction, if the patient was a child, he might bite on his lip or her lip and he might cause bruising to his lip or her lip. Clear? Clear until now? Same. يعني it's false pressure يعني directed on these tissues. Thrombocytopenia, that's the name of the disease. Okay. Thrombocytopenia. Ecchymosis is the sign that I see it. Okay? Thrombocytopenia. Yes.
بالون يا دكتور thrombocytopenia.
Penia. Penia.
ودي ايه؟
No, بالنون. Okay, thrombocytopenia. That's the name of the disease. Okay, if you touch him like this, he might get bruising. So, طبعا. If you direct a wrong force, either on the cheek or the lip, okay, this might happen. Gum already will be finished. If you are bruising the cheek, you will not touch the gum. No? Okay, clear until now?
Okay.
Emphysema. Emphysema. Does anybody know, Victoria? You're playing with the phone? What? Can anyone tell me what is emphysema?
It's a problem happening when you use a high speed,
Wow.
a high speed of a turbine, and when we do extraction for the upper maxillary, and air will be forced between the
Amazing.
tissue.
Thank you very much. Amazing. Okay, now, this emphysema means that the tissues is filled with air. Okay, so it will cause swelling to the patient. Okay, now, where is the air coming from? No, she said it already. Yes, say it. Turbine. The turbine. Our turbine is working on air and water. Okay? So, if I want to extract, and after I open the flap, if I want to extract, for example, lower 8 and I'm doing a big operations, I'm supposed to use electric handpiece. خلي كولن فيها. Okay? Electric handpiece. Okay? Electric handpiece should be used to remove the bone. Okay? Okay? Not the turbine. Emphysema. Soft tissue emphysema. Okay? Which is literally the tissue will be filled with air. It will be like a balloon. If you open a flap anywhere in the oral cavity and you remove bone by the turbine, 80% of these cases could get emphysema. Any flap. So any flap, if you want to remove the bone, please use electric handpiece. Okay? And a coolant for you. Okay? Coolant. Do you know what coolant means? Hey, whoa.
Air cooler. We will use air cooler.
So you will cook the bone. Okay? You will smell. You will smell the bone is burning. Okay? So you have to use a coolant. Okay? Water, warm saline, chlorhexidine, you can use it too, on the bear while it's cutting in the bone. Okay? Clear?
It's irreversible. You have it.
Come on, if you do necrosis to the bone, this is a huge problem. Okay? Clear? Injury to the inferior alveolar canal. That's the next point. Injury to the inferior alveolar canal. You remember in my first lecture upstairs, I said I had a case with the lower 8. The roots of the lower 8 was actually hugging the inferior alveolar canal, inferior alveolar nerve. Do you remember that?
No.
I said it to all the groups.
No.
Okay, I had a case and I told the patient that the sensation might be lost for 6 months, forever, or nothing might happen. Okay? Because the lower 8 was actually exactly holding the inferior alveolar canal. Yani the roots were not fused, diverged and then fused. Okay? Around the inferior alveolar nerve. Okay? So if you extract this tooth at once, definitely you will pull the inferior alveolar nerve with the tooth. Okay? Or if it was closed while luxating the tooth will crush the nerve. Okay? It will get back, but it will really annoy the patient for like years. Okay? Until it gets back. Okay? Clear?
I want to ask a question, but I'm not
Okay. Now, as we said, the lingual nerve injury. You saw the question of Dr. No, Thamer. Dr. Thamer, yes. He asked me, can I approach the lower 8 lingually by the elevator? I said, no, never. Never approach the lower 8, okay, from the lingual aspect. Okay? Because the lingual nerve is really close to that area. So if any slippage happened, خلاص, you will cut the lingual nerve. Okay? And the patient will lose the tongue sensation. Not the taste, just sensation. Will get numb. صدري. Okay? يعني يبقى طول عمره البيشنت لسانه عقله منمل إذا انقطع اللينجوال نيرف. Okay? Clear? No, if I extract the lower teeth, I always have to approach the tooth buccal side. I can't approach lingually. If I approach lingually, I will cut the lingual nerve. Okay, so please never approach the lower 8 from the lingual aspect. Yeah, because it's the closest. If you can do it, use it. You can't. You can't. How can you put the elevator like this? How can you put it like this? Here you have a whole skull. How can you put it lingually? But for the lower 8, you can come in this direction. Okay? But yeah, because you can't approach the other teeth lingually. How can you put it like this? I have a whole skull here.
What about upper?
Okay?
Upper. Is it another function?
No, the upper. What's with the upper teeth?
For upper, can we do lingually?
No, you can't.
Only upper.
Buccally, you can vertically. Okay? Lingually, please don't go palatally or lingually. You can. And if you are working here, how can you go from the other side? And you don't want to luxate another tooth? Impossible. Okay? No. Tongue. What is the problem if I enter the tongue? Severe bleeding. Severe bleeding. Because the tongue is highly vascular organ. Okay? Vale? No, because of the bleeding, bruising. Okay? Clear until now?
Clear.
Great. Right, it's the same point. That's the second point I'm going to explain. Maxillary sinus involvement. The first one I explained was the tooth fracture, because you saw it in the video. Okay, and the second one is this. Yeah, this is the last one. Okay? Patient came to the clinic Okay, and you want to extract remaining roots for the upper 6 or 7 or 8. Okay?
He wants this
Remaining
from-
roots. Yeah, let's say remaining roots. Okay? And while extracting the roots, okay, you got the first one, mesial buccal, the distal buccal, only the palatal remain. Okay? Only the palatal remain. And by accident, okay, of course you don't need to do it, by accident you will force the root
To the maxillary sinus.
to the maxillary sinus.
And
Okay?
oh,
So if you force the root to the maxillary sinus, here we have two problems. Here we have two problems. Okay? The first problem, we have to get that tooth out of that root. You have to get that root out of the sinus. That's the first problem. The second problem I'm facing, okay, is closure of this opening. Closure of this opening that happens between the maxillary sinus and the oral cavity. يعني بدون مشكلة معي. يا كم مشكلة تبي أو بارسيلة أنا كده ريبين. Okay? I'm going to say how. Okay? The second problem, you have to close this opening. تبي أو تنقبات كي. Okay? No, you don't have يعني not only suture.
by
I will
implant.
explain. I will
By
explain.
implant.
وردة مال الله. I'll explain.
إيه دكتور؟ مو لازم ناخذ قطعة من البيس من العظم يعني ونزرعها بهاي المكان؟
بس إلا تفتي. Okay. So, when I want to extract this remaining root that went into the sinus, I have two ways. Okay? Okay? The first method is pulling it of the sinus, and I'm going to say how. The second method is surgery. And I open the whole area and I expose the bone and I remove the bone and remove the tooth and then suture. Okay? That's the surgery. But the first point is very interesting and you will find a little bit hard for you to imagine. But first things first. I take an x-ray, okay? And I see where is the root located in the sinus. Okay? The sinus floor is like this. Okay? It's like this. And let's say the opening was here. Okay? And let's say the root went distally. Distally. Okay? How can I bring it close to the opening? That's the first thing that I should put in mind. I have to get this root close to the opening so I can pull it. Right? If you saw it, pull it. If you don't see it, you have to bring warm saline. Do you know what's warm saline? مغذي. شايف المغذي? Okay? Infusion. You will pull from it by the syringe, okay? And then in the opening, you will inject the saline just to closen the root to the opening. Okay? The root is located, let's say this is the opening, okay? This is the opening. And the root is here, okay? How can I move it? Should I do like this to the patient so I can move it? No. Okay? So I bring warm saline. And I start pushing the saline inside the sinus. The water will bring the root closer to the opening. Okay? So, and I take x-ray again and see if it was closed enough. خلاص. I will do the next procedure. If it was not closed, I repeat until it gets close. Okay? So it got close to the opening. Okay? It got close to the opening. Okay. So it got close to the opening. Okay? What should I do after this? I bring gauze. You know what gauze?
Shash.
Shash. The shash. I have a big comment on this. They call them goes. Okay? So, okay, but our goes is different from the other goes. Okay? Listen please. Listen please. So I'll bring the gauze, okay, and I will start filling the sinus from the opening by the gauze, okay. It will stuck to the root, okay, and then I pull the gauze at once. I will get the root out. Okay, clear? Okay. You will not face this situation. I did it once in my life. Yeah, but I didn't cause the opening. It came to me open. Yeah, from a friend, which was a female. Okay. Okay. So actually, she was my wife. Okay. So I have nothing to say. Okay.
She's the government.
Okay, so yeah, the dentist was my wife. Okay, but she definitely learned how to get it out now. Okay, and how not to insert it inside the sinus because I was crazy that day. Yeah, so back to the subject. So I inserted the gauze, okay, and I pulled it at once. And it came out. When it came out, it was a party in the clinic. Okay? Really? He got the anesthesia from the extraction. Okay? And if you are working with the sinus, only the sinus, you don't need to give anesthesia. Do you know why? Because the sinus does not contain any nerves. Okay? Clear until now? So, we insert the gauze. I did insert the gauze, okay? And I pulled it at once and I saw the roots coming out, okay? Now I have only one problem. How to close it. I have two ways to close it. Okay? The first way to close this opening, by the way, this opening is called oro-antrum communication. Oro-antrum communication, or fistula. Oro-antrum fistula. Okay? That's the name. Okay? So the closure can be by two methods. Either you bring connective tissue from the palate, you take connective tissue from the palate, okay, and then you suture it, okay, in the opening, or you have here the buccal mucosa is opened, right? Okay. Now I will bring an example. So, okay, laugh. Did you see Nasrat It? Yeah. The one. The one that does this thing. Okay. Have you seen him how to cut the meat? He does like this, and then, and he wants to stretch it more. True. He wants to stretch the meat more. He doesn't do like this. Okay? He cut and then he pull. He cut and then he pull. True? So we will do the same. We will do the same. But where? In front of the opening. In front of the opening, I will open the flap, trapezoid flap. Okay? I will show you the picture. I will open a flap. Okay? And then I will do what Nasrat does. Is called flap release. Flap release. Yeah. You will stretch the mucosa, okay? You will loosen the mucosa so you can pull it buccally and suture it palatally. Just like that. Can you see it? This is the fistula. He opened the flap. He released the flap just like that. He cut the gingiva from the inside, okay? From the inside, he released the flap. He was loosening the mucosa, okay? And then he pulled it to the palatal side and he sutured it.
يعني يقول تعودي ولا
You have to loosen it because it's very tough. Okay, you have to loosen it. Yeah. So لبنوة so it will be loosened, okay, and you will bring it buccally and you will suture it palatally.
But without the soap.
After time,
Actually, that's what I did in the clinic.
after the time compact and
Yeah. Look, I brought an example of this guy, okay, to understand something called flap release. Flap release. Flap release means after I do the incision and I elevate the gingiva, okay, I need this mucosa, the buccal mucosa, to be loose. Okay, so I can stretch it to the palatal side, just like in the picture. Okay? Okay? Until now? So what I do, like Nasrat, I cut يعني the periosteum of the bone, not the gingiva. يعني it will be facing the bone, I will cut, and then I will stretch the buccal mucosa and pull it palatally on the opening and suture it palatally. Okay?
كيفاش وقت تشوف period نرسلته خذ period نرسلته
دكتور رشد دكتور وقت ناتشري دكتور يعني وقت طبيعي خولي دكتور دروس دكتور لقى
And the bone will be reformed again because the sinus has a nature, okay, forming a bone again. If it feels it's in danger, it will form the bone again. But to a limit that protects it, not to a limit like go, it doesn't create a lot of bone, just to a limit that can protect it.
خلينا مقارنة ما سوينا شيء
Infections, everything he or she eats will get inside the sinus. If he drinks water, he comes out of his nose. So, a lot of problems. And the infections are in the skull. So, if it's reached the danger zone, you remember the danger zone? This is the danger zone. If it reached this zone, the infection, it will simply go to the cavernous sinus and will cause cavernous sinus thrombosis. Okay, so it's very dangerous if you leave it. Okay?
يعني الألبوجين and then suture it
No,
antibiotic inhibition.
no. Because Alvogen is a treatment of a dry socket, which is I'm going to say now. Okay? I didn't want to say. Okay. No, it's tough. You have to stretch it. يعني زور بقوة ناتواني أمراض شيء يكسر داني. If you stretch it too much, this tissue you stretched will die because ischemia will happen. Okay? So you have to make it loose. Okay? So the blood vessels stay intact inside the flap. Okay? And suture it palatally. Okay? Everything is clear? The last point I didn't write, I'm sorry, which is dry socket. Dry socket. Simply, it's infection of the alveolar bone post-extraction. And after extraction, infection will occur to the alveolar bone. It's also called alveolitis. Either it's dry socket or alveolitis. Huh? Yeah. Okay. Causes are a lot. Treatment is a book. Okay. Clear? Dry socket. Final thing, yani dry socket? Okay. The dry socket is infection, okay, occurs to the alveolar bone after the extraction. Okay? Mainly because of the clot that was supposed to happen, it's removed. The clot, the blood clot. Okay, why do we put the cotton on the socket? So the clot can be formed, okay, the clot will start the healing process, okay? But if the patient removed the cotton and the clot with it, so the socket will get dry, it will be easily infected, okay? The infection is also called alveolitis.
So the question was put the cotton forward long.
Must not touch.
Yes, yes, okay? Clear? Treatment of dry socket, it will be in the lecture, inshallah.
That causes ما شو causes.
Causes, a lot of causes. One of the causes is this, I said, the patient removes the cotton, okay, and leaves the socket bleeding. Bleeding is the second cause, okay? يعني the bleeding. Some people does not do in dentist words. Can you tell them something? Once, I have a balcony in my clinic. Okay, so once I extracted a tooth, lower 8 actually, it was an operation. And I told the patient, please don't smoke today. Smoking is another cause. Okay, to dry socket. Okay, so he said, okay, I will not smoke. Smoking can does two things to the socket. First thing is heat of the cigarette. Okay. Second thing, while he is sucking, he will suck the cotton too, and he will remove the clot. Okay? So I told him don't smoke, okay? And I was outside the balcony smoking, okay? And I saw him, he was smoking. As soon as he got out of the clinic, he opened a cigarette and he was smoking. Okay? So he got back. Some things that leave a space for the bacteria to attack. It's bacteria, of course. Okay? بس اكو اشياء اذا راحت البكتيريا راح يصير عندها مجال انه تسوي الغزو مالتها. الاشياء هذه bleeding, okay? Bleeding, okay? The clot if it was removed, sucking of the cotton, smoking, okay? Smoking. What else? The instrument was not sterilized. Okay. The patient came back. This patient. Yes, the patient came back. Look, sorry, yeah. But what you are saying is curettage, right? Curettage. You hear about it? That we injure the socket so we can have bleeding again. Yes. This will cause another infection, okay? This curettage will cause another infection called osteomyelitis. Now, instead of doing a very simple thing to treat this patient, you will have to remove the mandible by curettage. Okay? Curettage, if you did curettage just to injure the socket again, you will spread the infection. Okay?